Let's go ahead and get started. Christine Reese, I've been with Delta Dental. I'm in my 9th year with Delta, but I've actually been in the dental industry for over 25 years, so it's my pleasure to welcome you to our Going Green webinar today. With me today, I also have Ken Kurtzig, who is the CEO of iReuse. We've partnered with Ken and his company for several years now, and he's really assisted our company at making a difference in all the environmental impact that we have in the world today, and helped us look at it from a different perspective and really taken some measures to reduce our environmental impact. And all of us will actually spend some time in talking a little bit about our areas of expertise. In addition to Ken, we also have Dr. Jasmine Gordon, who is an orthodontist in Northern California. We have the privilege of having Dr. Gordon with us today, and she's going to talk about her practice and what she did, and really some of the quick wins that you can realize as a dental office to go ahead and incorporate this green dentistry approach into your practice as well. And then we'll reserve some time for questions and feedback. So today's webinar is really to empower you with some facts that will allow you to realize a cost savings, provide a healthy space for both employees and the patients in your practice, and then to be better stewards of the environment in general. We actually, as a company, have incorporated this, and it's been several years because we realize how many pieces of paper we actually mail out in a year, and Ken actually came to us with some of the initial ideas, allowing us to really quickly take advantage of them. So we had a short-term plan, and we also had a long-term plan that really has made a difference within our own company. So we want to make sure that all of the companies we do business, vendors, providers, enrollees, patients, they all have a part that they can play in helping us make this change in our communities. So with that, I would like to go ahead and turn it over to Ken, and I'll come back in and help facilitate the question and answer piece.
Thank you so much, Christine. As I said, my name is Ken Kurtzig. I'm the CEO of iReuse. We're an environmental consulting company, and we've worked with Delta now for about 6 years, looking at across their entire enterprise, which obviously is across the country, and looking at their various environmental impacts around energy, water, waste, purchasing, paper. And as Christine said, the environmental impact of Delta Dental doesn't just fall inside the walls of our buildings, but also all of our interactions and our suppliers and our partners, so the dental offices and the patients, and how does that system all work together. So I'm going to talk for a couple of minutes about Delta Dental in general and what we've done to try to be more environmentally friendly and what we're continuing to do. And then I'm going to go into some checklists and various programs on and resources for dental offices themselves to actually start to implement different efforts that could save money and be more environmentally friendly. And our goal is really to kind of collaborate. It's to share some best practices that we know of and provide support and resources to the practice groups and the provider groups. So just a few data points. We have had a big push at Delta Dental in the last 3 years to try to drive more online adoption and paper suppression, and there's been some tremendous results. We've suppressed about 15.7 million mailings, which is equivalent to about 5,700 trees, and obviously there's also financial benefits as well by not mailing out as much material. We're still, in some respects, kind of scratching the surface a little bit. There's still a ton of opportunity both for providers and enrollees to have better online engagement and continue to try to do more work online and less paper.
I'm going to just take a minute now to go into a bit of what we're doing at Delta Dental on an enterprise basis. We're, as a company, about a $15 billion insurance company servicing 33 million enrollees and working with about 95,000 provider partners. So the scale is pretty large, and so there's a couple key areas where we have a significant impact, and we measure our impacts and progress over time. So we've been tracking our GHG emissions for many years now, and as you can see, we've had roughly a 17% reduction in GHG emissions, both through our energy efficiency measures, through our reduced printing purposes, water conservation, waste reduction, more efficient travel, and things like that. We continue to set goals and try to continue to reduce our emissions. Energy is a big part of our company's impact. We are an insurance company, so we have buildings across the country, staff at desks and computers and servers. And so we've had a significant reduction there, which has been tremendous. And our data center has actually done a great job. Our IT team has done a great job of reducing in energy usage and demand, and also continuing to implement best practices. Waste reduction, clearly at office buildings, is a big part of it. Waste has a big environmental impact, cost impact, and produces things like methane, which are much more harmful than carbon dioxide. So we've had a significant reduction in waste to landfill, about 28% from 2008 to 2015, although we still have lots of opportunity for improvement here. The last piece that I'll just focus on has been paper. Internally within Delta Dental, we've actually done an amazing job of reducing our consumption of paper usage through double-sided printing, through big campaigns to drive people to do more communications electronically and print less. And so that's been really successful. And that also kind of feeds into our focus now of how do we work more closely with our partners and our providers and our enrollees to do as much paperless communications as possible.
And this just is a high-level overview of some of the environmental impacts. We've done a lot of assessment of paper usage and the environmental impact of paper. In 2015, for example, we're just working on our 2016 results. We mailed out 9.4 million claims, which is about 4,500 trees. So it's a huge opportunity to try to drive online adoption and try to prevent a lot of that paper usage, which is very intensive beyond just the trees, but also energy, transporting all the material, water that goes into cleaning and repairing paper, and obviously the trees. So there's a pretty broad and large impact from mailing. I'm going to shift now away from just Delta Dental and what we're doing to some information and resources and kind of the core focus of this webinar of what's out there for dental offices. What can dental offices do? What's easy? What's hard? What can you start doing today or even long term, and why do it? There's a lot of research and data on it. If you go to Google and search for green dentistry, there's 80 million hits on different content or resources. So it's a pretty popular topic, and there's lots of resources. I'm going to try to focus on kind of the key takeaways and some simple tools that you all can use starting today to think about your office, what you're doing, and are there simple things you can do to kind of get the ball rolling if you haven't done so already. There's three primary reasons why organizations in general would be interested in becoming more environmentally friendly or sustainable. If you haven't heard, the people, planet, and profit. So certainly the profit section, there's a lot of things you can do, and I'll go through a couple, and Dr. Gorton will go through several as well, where you can actually save quite a bit of money while being more environmentally friendly. And that's, a lot of the programs that we have at Delta Dental, some of them definitely have financial and environmental benefits. Some of them have more environmental benefit, but it's all kind of a balancing act. The people for sure, and Dr. Gorton, I know this is an important part for her, is creating a healthy, happy work environment for herself and her employees. Since you spend, whatever, 8 to 12 hours a day in this environment, you don't want, horrible, harmful chemicals. And then planet for sure, looking at, not only your environment where you live and work and how to make that a healthier place, but also how do we all work together on building a healthier environment. And all of these different programs have some impact in all three of those areas in people, planet, and profit. So here are a few of the key largest impacts that we see in dental offices from various research areas. So first is, looking at things like conventional x-rays that use 28 million liters of toxic x-ray fixer, which is often dumped into the water stream in the U.S. Mercury is obviously a huge part of dentistry. Actually, dentists make up about 50% of all mercury pollution, so that's obviously a big opportunity for continuing to improve. Sterilization and barriers, so 1.7 billion sterilization packages disposed in landfill every year, which is kind of an alarming number. And then things like water usage. An average dental office uses about 360 gallons per day, so it's about 9 billion gallons of clean drinking water a year. So it's a very water-intensive industry. And the key around these things is figuring out, as opposed to just trying to do everything, it's kind of trying to understand what are your biggest impacts. Where are the things, if you were to focus on 4 things or 5 things, where would you have the biggest opportunity to reduce your environmental impact, reduce your maybe save money, and make it a healthier, happier work environment for employees? On the next couple slides, I'm going to go through a really valuable tool. There's a few tools on the internet that you can find on the web for like checklists and resources for green dental offices. This is a great way to start to get your head around where should I focus, what should I do. This one happens to be the San Francisco Green Business Program, which is specific to dental practices. There's not a lot of green dental checklists This is one of the better ones that we found, and that's why we wanted to make sure we share it, and I'll go through it. And actually, it's on the right-hand side as well under handouts, and I'll kind of talk about how this is structured. So it's broken up, as you can see on the left-hand side, into the main categories of sustainability for a dental office. There's general, there's waste, energy, water, and pollution. Those are kind of the 5 main categories, and then within each of those, this green business program has suggestions of things that you really should be focusing on and every dental office should try to do. And then there's more optional items that will continue to help drive your sustainability efforts. This checklist is kind of designed for dental offices that want to get certified. Obviously, if you're not in San Francisco, you can't get certified under this program, but the checklist is really valuable to even help anyone across the country think about and go through your daily practices and some things you can do. Whether you just want to do a few things or you want to go full bore and get certified and LEED certified and all these things. So this section I'm showing right now is we'll look at like the waste reduction. So this checklist is broken up into the bold ones at the top are like, key items that you really want to do that every dental office should really practice on, and simple things. These are not really expensive things. So things like, 2-01 is keep a stack of previously used papers near a printer to use as scratch paper, or trying to eliminate individual bottles of water for employees and guests. So can you use mugs and things like that? So these are simple things. And then sometimes more time-consuming or pieces that require a little more effort would be the other items down below. So I'm going to go through a few key categories and like a few key high-level things that you can do. First is pollution prevention. And again, this is all kind of from that checklist. But certainly looking at how you store and handle and titrate amalgams is a key part of dentistry, as we talked about going back to the mercury. So looking at what your current methodologies are around how to handle hazardous material and making sure that it's not ending up in the water stream is really important for dental offices. And then, as we talked about before, using digital x-ray equipment, not only using digital x-ray equipment to prevent a major pollution issue, but also looking at the long-term financial impacts of that. So, certainly there's upfront costs, but there's also long-term savings opportunities. So looking at the entire impact of changes like that. And then also looking at different chemicals you're using, like your cold sterilants, like glutaraldehyde, and how to use less toxic hydrogen peroxide materials. Waste reduction is another key part. There's 2 aspects. One is upstream, looking at the stuff that you're consuming and using, and there are materials that you can use that actually don't even need to go in the garbage can or recycling bin. So using things like cloth wraps for sterilization, and maybe not giving out prepackaged products to every patient that comes in, but only upon request. And then also a key one is obviously going paperless. The less you print out, the less has to go in the recycling bin. And then downstream is looking at, as you guys are throwing out materials, making sure that you have proper recycling, and if your city or county has composting, making sure that as much of that material is going into recycling or composting and not into a landfill. And there's significant environmental benefits to that, and often usually cost savings. Usually recycling and composting is free or closer to free, or certainly much less expensive than landfill. Next is energy is a big part as well. So here's 3 simple things, again, that dental offices can do pretty quickly. One is Energy Star office equipment is significantly more efficient. So looking at, the computer I'm looking at right now is Energy Star rated, which uses much less energy than a standard computer or things like printers, thermostats, things like that. Thermostats are a big thing also, and you'll get this from the checklist as well. And how to program your thermostat, that's usually a big opportunity that kind of goes unnoticed. Even like a couple degree change actually has a pretty significant impact on energy usage for an office space. And then there's things like lighting is a big opportunity as well. A lot of office spaces still use T12 lamps, which are horribly inefficient, and actually they don't even sell the fixtures anymore because they're so inefficient. And there's now T8 or even T5 lamps that will save anywhere between 40 and 80% on your energy per light. We had one client that changed just recently, I think it was $12 a year per light bulb for going from a T12 down to a T8. So the savings is significant for all that energy savings. Water conservation is obviously a big part for dental offices as well. Looking at things like dry vacuum pumps. Aerators are a really simple addition. Either you can get them for free from your local water district or buy them for like a couple dollars at the local hardware store, and it reduces your water flow without you actually noticing the difference. And then things like autoclaves with water recirculation. The last sections I want to go through are purchasing. So looking at the materials that you're buying, there's actually some great certifications that I have listed down below where you can look and see if the cleaning supplies you're buying are either certified as like green, or there's this good guide, which is like a rating system that'll look at different materials and show, are there alternatives that you could buy? It could cost the exact same amount, but just making smarter decisions and saying, hey, would I rather use something that's really harmful to my health or use something that's not harmful to my health, and it costs pretty much the same thing? That's kind of a no-brainer. And then things like there's an EPEAT certification for computers, so there's other rating systems, so you don't have to do all the research. There's a lot of organizations out there that do the research for you to make it easy to look at more environmentally friendly or less harmful products and materials. I really like the Green Seal Certified and the Good Guide as great tools to search for products for your office. The last thing is just general sustainability. I think a key to success, and I think Dr. Gordon will talk about this a little bit as well, is letting customers know what you're doing. As you're starting to make progress on some of your sustainability efforts, whether you've already made a bunch of progress or you are making progress, letting your patients know that you're now using Green Seal certified cleaning products, you no longer have horrible chemicals that you're spraying counters with. They definitely appreciate that. And then also posting signage. I think when patients come in, just little things that they can see that you're actually trying. So things like recycling bins with signage, or things about, products you're using, or Green Seal or certification really helps them, makes them aware of what you're doing and your commitment. And obviously there's some patient benefit as well as potentially revenue benefit if you can attract more customers and retain them longer because they are in line with what you're doing and having a healthy work environment. And I know Dr. Gordon will talk about that as well. So that's kind of an overview of, and again, I really recommend on the right-hand side, under the handouts, there's a checklist. Take it, bring it up on your computer, just go through there and see what you're already doing, what you're not doing, and then what are the simple things you can start to get rolling. And certainly in your city, there may be green business certifications as well, and that's a great way, and they'll often help you go through those checklists and kind of hold your hand. So with that said, I want to introduce Dr. Gordon. She is an orthodontist here in Northern California, and she has an amazing office which she'll go to, and I love it. It's inspirational, and the benefits she's had kind of cross that people, planet, profit, and she's going to talk all about that. She got her bachelor's degree at UC Berkeley, and then went to Harvard, as you can see, and got her doctorate in dental medicine. She got her postdoctorate at UCSF, and her master's in oral biology, and as well as certification in orthodontics. And she's board certified in orthodontics. And she has a private practice in Marin County, California. So I'll turn it over to Dr. Gordon now.
So this is an overview of our office, and we wanted it to sort of scream green when you walk in, so we do have a little extra plant life in there to start getting the message across. But this was, we moved recently, and it was an opportunity. We had always been green in the way we were practicing and everything that we could do, but when we moved to a new office and had to remodel the existing space, that was an opportunity to incorporate even more green functions into the building process. And so now we were able to take it to the level of actually getting green certification. So one of the things that we did, you could see in this photograph here, is we had only 2 windows, but we did everything we could in the office design to maximize the natural light with only 2 sets of windows. And so everything in the office design, every wall that was torn down, was dedicated towards maximizing the natural light. Another thing we did, the living wall, of course, bring a little oxygen in, and openable windows. Not everybody has an opportunity to have that, but if you can, obviously openable windows in a place like California works well. Less air conditioning, and so that helps a lot. Over here is our toothbrushing stand, and into the build-out was incorporated having the low-flow sensor faucets, and those conserve water, as well as the cups. If they're not plastic, they're recyclable. Everything we order is ecological, so these are paper cups. You also notice the clean look. That's something that comes of this type of faucet system and soap system, is that not only is it conserving resources, it's just a cleaner look as well. Some of the other things we did, all of our lighting is LED. Aside from the cost savings of not having to replace bulbs, sometimes people make the mistake of looking at the initial cost But you have to think, if you're going to be practicing for more than a year, what is the cost over time? And so with LED, you have a little bit higher initial cost, but then you don't have to change your light bulbs for 10 years, which I can assure you, having been in practice for a while, it's a very practical thing, not having to worry about in the middle of clinic one of your main lights going out. So we did choose LED lighting that mimics natural sunlight. It also gives sort of a pleasing aspect to the office when you walk in, that it's mimicking natural sunlight and not making us all look jaundiced like some of the conventional lights. We also went with a cork flooring. It gives the warmth of a hardwood floor, but being cork, then obviously that's ecological as well. It's also more quiet. It makes everything sound very peaceful, even if there are a lot of patients in at the same time, which anyone who's seen an orthodontic office after school knows that can happen. So that helps with that. Paperless was huge. I'm going to be mentioning that many times. Going paperless, once you do it, you'll wonder why you didn't do it sooner. So we do have computers chairside so that we can do our charting chairside. We went to paperless charting, gosh, I don't know, back in the year 2000 or something like this. It was a very long time ago. And now I can't imagine why we had that even in the first place, all the blood and spit and stuff all over the charts. It's just not a good idea. But anyway, going paperless, strongly recommend it for everything, and it's a little bit of a learning curve at the very beginning, and again, you'll wonder why you didn't do it sooner. For the cleaners, it's also nice to go eco with the cleaners, because as Ken mentioned, if you're in that office all the time and so is your staff, the people that are going to have the most problems with sensitivity reactions aren't actually going to be your patients. It's going to be you and your staff. And so if you're switching from spraying the surfaces to wiping them down, and you're switching which methods of cleaning that you use, it's going to be better for everyone who works there as well. So I did some slides on the sort of who, what, when, where, how, why sort of theme. So this is the who benefits. Again, patients, of course, a lot of, I don't know what it is that's happening, but we are seeing, at least in our area, an increasing number of patients are suffering from hypersensitivity reactions. And the last thing you want is for them to say it came from your office. That doesn't work well for PR. So the other thing is that ecologically conscious products minimize the risk of an allergic reaction being triggered by your office environment. Again, you want to make sure that nothing that they're having done in your office is triggering a reaction if possible. Staff and team members, as I mentioned, we're in the office for very long stretches of time, several days a week. And a healthy environment helps with staff productivity and retention. You don't want people out because they're having trouble with asthma or whatnot for something that was a pathogen in your office. Healthcare providers also, I feel, and I wrote this at the bottom of the slide, I do feel that healthcare providers have the responsibility to provide a healthy office for both the patients and staff. I mean, not to throw out the word hypocritical, but if you're in a healthcare field and you're not doing everything you can towards making things healthy for everyone involved, then yeah, it's a little funny. So here's some examples of going green and results. So I just gave some examples of an action taken. I think that a lot of people maybe are hesitant to jump in and try to make their office green. I want to differentiate, and Ken had referred to this, I want to differentiate between being officially LEED certified versus a green certification versus just going green. We chose to get officially green certified. We're fortunate that there is a program in our area where you can have green certification without doing LEED certification. The benefit of that is primarily financial and efficiency. It takes a little longer and more financial resources to get the official LEED certification, and we were in a hurry with our build out and trying to save money for things that were going to be directly impacting our patients. So that is why we went with the green certification. But if green certification isn't offered in your office, you could still go through the checklist and put your own sign up saying meeting all green certification requirements, and your patients will appreciate it just as much. Anyway, here's some examples of how to make this happen. So the action taken. Did I mention paperless? All right, so paperless everything. Paperless statements, paperless billing, paperless new intake patient forms. We did, I'm like you. I'm what we call a wet dentist, meaning that 9 times out of 10 I'm in somebody's mouth, and I don't have time to be worrying about things like this. And so we did hire a third party that handles all of the financial and new patient forms and electronic insurance filing. Obviously, it's okay to get outside help. It also makes our office seem more modern. So the results on the environment, literally tons of paper per year. You don't even realize it's how much paper you're going through. I liked Ken's idea of setting the paper you use next to the printer so you can reuse it, and I was laughing because I thought, yeah, that stack of paper next to your printer is probably going to be 5 feet tall by the end of the day. So if anything, it'll give you a sort of wake-up call on how much paper you're really going through. I think people don't realize it. Anyway, the financial results, we saved a lot of money on having to get expensive office, logos, stationery, a lot more than you would ever dream of on postage. And also, you're paying your staff member a good amount of money to, lick an envelope and stick a stamp on and put the address on. So there's a lot of hidden costs that people don't realize with using paper. The results for the patient. It provided easy online tracking for patients and the convenience of access 24/7 to their finances. We're not going to have a person in the office answering the phone to, tell them about their financial statement at 2 o'clock in the morning. So using, if you can use a third party where they can track it online, it makes it a lot easier for the patients. Another action taken. We, of course, went paperless with our charts. We went digital x-rays, digital photos, even the patient-doctor communication. Unless there's a doctor as a specialist, I can't tell other doctors what to do. So there are some limitations. But I feel that our going paperless, even as a specialist, has really encouraged our referring doctors to go paperless. It gave them an example of how it can be done and how easy it is to do. And once we started doing it, we got most of them to switch over. I only have maybe one holdout left out of the whole county. So you can fearlessly pave the way. And once people realize how easy it is, there's no going back. How we did it, many practice management softwares are available, and file sharing programs and secure email are also available. These are out in the market everywhere. So you just pick a practice management software that makes sense for you and use it. And then in terms of the environment, again, reducing tons of paper a year, x-ray chemicals. I can't remember the last time we had a regular x-ray. It was when I was a kid. So we've been digital for a very long time. The financial results, you save a lot of money on the specialized photo paper, the printers, the staff time filing and storing old files. Also imagine the storage space. When we converted to paperless back in the year 2000, all of a sudden we had a lot of cabinetry that was available for other things where we had been storing all our charts. And the staff had a lot more time available because I wasn't paying a lot of money to someone to file and pull charts who wasn't intelligent enough to do something more challenging. Results for the patients. Again, hygienic. Think about those paper charts out in clinic. Legible, especially in an office where you have different people working, more than one person working, and you have to read each other's notes. That can be tricky. It reduces human error. When you have a practice management software on the computer, then you can pre-populate certain protocols in a certain way. It also provides remote access. Those of you who are celebrating winter right now, California doesn't, but those of you celebrating winter right now, you could be on a tropical island working on your patient charts, right? If you have remote access, which you would not be able to do with paper. Imagine boarding the plane with 100 patient charts. Another example of an action taken is cloud software. So this is really helpful in terms of getting rid of a lot of the expense and clutter of having a server. So how we did it, implementation, we selected a true cloud company. You do have to be careful with marketing. You can't believe everything you hear. Some of the companies say they're cloud, and they're not really. They're remote desktop software. So, ask a computer guy to look into that for you. But if you find a dental company that's true cloud with a stable business platform, just meaning they've been around for a while, you don't want to have to change just because they went out of business, that's the company you need to pick. The results on the environment, reduced electronic waste, reduced electricity needed to power up the server and keep it cool. You hear all these articles about having a server room in your dental office and keeping it a certain temperature and taking care of the servers like they're newborns. You don't have to worry about any of this if you're on the cloud. You do not have a server, and servers, as you know, people who have one, are extremely expensive. So it's an incredible cost savings. So the financial results, you save a lot of money on expensive server, which of course they need periodic updates, and then you have to buy a new server from time to time. So I strongly recommend the cloud. The results for the patients: improved customer service via quick chart access. Again, I could be literally on my phone, riding in a car, obviously not driving, right? And I can have a question about a patient. I can pull up the chart on my cell phone within a couple seconds anywhere I have internet, and I can get into the patient's chart, answer the question. That's something that's available with cloud software that just helps you be more flexible with your personal life and at the same time maintain your services. So again, along with saying paperless over and over and over, easy is the other thing I want to say over and over. It was so much easier than I thought. So surprisingly easy to do and need not be expensive. So what I literally did, I took the lowest person on my totem pole at work, which was the high school girl who helps me with after school sterilization, and I had her just get the checklist online and go through. And so replace your paper towels with recycled ones, to get real towels where there's paper towels. It's really not hard at all. So this high school girl did it for me. Obviously she doesn't get a very high hourly wage, and it didn't take her a lot of time. And she took care of it, and she communicated with the green certification people, and they came by and took a look, and we passed everything except for we'd forgotten the recycled toilet paper. But you know, it's easy to do it. I think people get worried about what it's going to take to jump in, but it's easy and it's not expensive. Obviously, if you're doing a remodel or a build out, then you can take it to the next level, and it's even easier. You simply tell your contractor, I want this to meet the LEED certification specifications. So you build as if it were LEED, and then it'll automatically be fine. So you don't need to take time from your life to make this happen, and you don't need to put a lot of financial resources toward it either. So it does save money and reduce environmental impact, so you can feel good that you're doing something good for the environment as well. Again, once you're done, you'll wonder why it took you so long. And also, more and more these days, the green is the new black, right? It's becoming something really consumers are really aware of. So you do want to ask yourself, what image is your office projecting to your patients? Your patients are becoming more and more aware of being green. And you want to be at the forefront showing your patients that your office cares about them and cares about the environment. And patients, this does matter to them. It's difficult for a patient to know how you prepped the box on the DO of number 12, but they will know whether or not you're projecting the sort of environmentally conscious image with your practice. So I did include a couple helpful websites along with the one that Ken already included. And then if you have any questions, feel free.
Thank you very much, Dr. Gordon. I did also want to mention, for those of you that are in the state of California, I do have a continuing education certificate that I've added to the handout section. Please feel free to download that certificate. It has all of the necessary information that you need for your continuing education credits. So with that, I would like to go through our first question is for Dr. Gordon. They're complimenting how beautiful your office looks and wanted to find out how much of that is due to the focus on the greener construction materials, and did it actually cost you more to select green materials?
So those are good questions. There were two things that I did that were expensive, but I wanted them badly enough to make it happen, and that was the living wall and the cork floor. But aside from that, no. The rest of it, like as I mentioned, the rest of it, you can't look at it as a what I spend today expense. You have to look at it more over time. And so my build out wasn't necessarily expensive because of the green. You could have gotten a bamboo floor, which probably would have been a little bit less. I wanted the quietness. So
okay,
a lot of it has to do with the green. So, for example, at the very first slide, I mentioned that I wanted to maximize natural light. That's not just an ecological thing; it's also a personal preference. I feel that things are better with natural light. And so obviously trying to maximize those two windows then led to using glass instead of walls for partitions and using more of an open bay format. And so a lot of that came from being green. I would say a lot of the office design came from being green and the openness, and yeah, I would say a lot of it.
Okay. I have the privilege for Delta Dental to be the webinar trainer on teaching providers how to use and rely upon our Provider Tools website that we've designed with some pretty significant enhancements, allowing it to be more self-service. So trying to be considerate to the fact that you have limited resources within your practice. And so we've made it so that you can then, as Dr. Gordon mentioned, if you wanted to look up something in your Provider Tools account, you can do it at midnight or 1 in the morning. And we don't have customer service agents that are available to you at that time, but we have tools available that will make it easier if there is some time that you have or insomnia and you wanted to look to see, you know, somebody's benefit and eligibility package. Those tools are available to you, and we do have webinars that we offer to teach you how to use those tools to make it easier and save some time within your practice.
So Christine, you were kind of joking a little bit there, but we do our consults after hours. And so my front desk is logging in to your website to check somebody's benefits at like 6 o'clock at night. So it's not as crazy as you think, especially if you take into account different time zones. So being able to access things online and not have to mail in or wait for a mailed paper announcement, that's, boy, once you go there, there's no going back. It doesn't make sense anymore to have the paper.
So thank you for adding to that. I certainly appreciate it. And I do want you guys to know that we are actually not paying Dr. Gordon to share these messages with us.
I forgot to mention that.
She actually fortunately donated her time and information that she's sharing today as a result of the commitment that she's made to making her practice green, and to her employees, patients, and otherwise the environment in general, because she's a strong believer in this for the benefit of the greater good. So I just wanted to mention that. I don't know if there's something you wanted to add there, Dr. Gordon.
Yeah, good point. There's no disclaimers. I don't work for anybody but myself.
Okay, so next question that came in, it's around amalgams. Since we did mention mercury, it says amalgams are a big part of dental office environments, and Delta Dental's coverage oftentimes doesn't encourage the use of porcelain or other environmentally friendly materials, and would we consider changing this policy? So I want to just take a few moments to explain how our benefit packages are put together. We put packages together that employer groups are asking for. So they have a number of different options. If they're looking at spending X number of dollars, we have a package they can look at. But if they wanted to have a part of one and a part of another and customize one and make it affordable so that they can still deliver or provide both medical and dental insurance coverage to their employees, they look at ways that they can cut back or reduce costs to allow them to continue to support both a medical and dental package. So many of the policies that we have in place are around the packages that the employer group has asked us to customize to make it more affordable to offer the packages to their employees. So any employer has the option to include posterior composites, for example, as an option to the plan. And I'm hoping that over time, as we continue to drive, this effort through our communities, that those employers would consider including that as part of one of the provisions of the plan. All right, so next question is for Dr. Gordon. If you were to do your build out again, what would you do differently, if anything?
Yeah, there is one thing. So much thought went into it to avoid having to have any answer to this question. I wanted to say no, everything's perfect. I did make one little mistake. I wanted the cork floor to look like a hardwood floor, and I wanted that warm, rich color that was provided to me by the covering on it. And the lesson learned there was don't try to pretend something is what it's not. I should have just gone with the cork look. because we see almost 100 patients a day, and we're rolling around in our chairs all the time. And foot traffic-wise, it's held up well, but the wheels on our chairs are starting to nick up the coating that made it look that color. So that was my one big mistake. Overall, the practice was so well received that we've had, gosh, we're only 2 years into it. We had about 25% growth the first year, another 30% growth the second year. People walk in and they appreciate the environment. Like I said, I wanted it to scream green, and it does, and people appreciate that. So we've had such enormous growth that it's certainly been worth it. The only little snafu was trying to make the cork floor really look like hardwood. It should just look like cork.
And I think the next two questions, Dr. Gordon, are kind of tied to it. Is are you planning to do anything more to the practice to make it even more friendly, and maybe possibly, keeping up to date with the new materials and options that you could consider in the future? And then, in addition to that, is what impact has it had on your patient volumes?
Yes, the impact on patient volume I just spoke to. It's within our 2 years of our move, we've had about 50% growth, 55% actually. And so in terms of what I plan to do to update it, it's only been 2 years. I don't think anything too earth-shattering has come up yet, but I have the ability to reach out to the green certification person who came through and just have her let me know if there's anything new, or have her come back through again and just do a spot check, sort of like you do with OSHA. You just have them come by every once in a while, make sure everything's copacetic. And so we would be doing the same thing with her as well. Obviously, preparing for this webinar, I had a chance to review everything and make sure there was nothing else I could be doing. At this point, there just isn't. I have done everything that we could do. But, just like OSHA, just check in every once in a while and see if there's anything else you could touch up or spruce up.
So with that really covers anything. I don't know, Ken, if there's any closing comments that you wanted to make, or Dr. Gordon. You might want to put the contact information, Ken, on the screen. Or was it there? So that if people do have follow-up questions, we're certainly happy to answer or address any questions, or to find out additional information for you, or at least point you in the right direction. There are the handouts that I mentioned previously that you're welcome to download. We're certainly always interested in knowing what type of webinars you'd like us to host in the future. And this was actually one of our first webinars that we provided that wasn't about self-service automation or provider tools. And I'm so pleased with the interest that you've demonstrated by taking time out of your day to learn more about it today. We're also very interested in having you share with us different topics that you would like us to consider in 2017. So thank you again for your time. And then Dr. Gordon or Ken, any closing comments?
We are planning to have another session just around the topic of paper with more data about both adult dental as well as practices and the impact of paper. But if you have suggestions or want information or resources that we can help with, or topics in the future, definitely let us know.
Okay, well, thank you to our panelists today for a wealth of information, and for all of the attendees for your interest in this topic. And we hope to see you at a future webinar in 2017.